Well, after a year in the making, there is now the nation's first obesity bill of rights, created so that people with obesity will be screened, diagnosed, counseled, and treated according to medical guidelines without the fear of weight bias or ageism within the healthcare system. It has the backing of 40 national organizations and also several lawmakers. Here now, Patty Nece, immediate past chair of the Obesity Action Coalition. Thank you, Patty, for being with us. Why was this necessary?
Most people with obesity or who live their lives in larger bodies fear engaging with the healthcare system because you're just not welcomed. From the start, when you walk in the door of, let's say, a physician's office, in many cases, there won't be adequately sized chairs in the waiting room. They might not have adequately sized gowns, adequately sized blood pressure cuffs. They might weigh you in public. All these different things contribute to a feeling that, you're just not welcome. And then you have to steel yourself for being lectured about your weight. And sometimes you're not there for your weight. You have something else going on. And what can happen, and what happened to me in one instance, is that doctors miss diagnoses because they attribute everything to someone's weight without looking past their weight. So the Obesity Bill of Rights, I think at its core, is basic respect for people who live their lives in larger bodies, respect by providing adequate facilities, respect by understanding obesity and the ways to treat it for those people who want to engage with the medical system to treat their obesity.
There has been a stigma around obesity for years. I'm curious if the weight loss drugs that we're seeing have further stigmatized the community, because now you have people who are taking these drugs and losing weight. How has that impacted the challenges those facing obesity face?
I think it's early days yet, and we'll see how that plays out. It can be a double-edged sword. On the one hand, someone who chooses to address their weight by, let's say, using an anti-obesity medication, people may say you're taking an easy way out. At the same time, other people who choose not to address their obesity can be faulted for that. You are stuck in the middle of two competing interests, basically. And I think we'll have to see how it all plays out with the anti-obesity medications. But I do think they have helped spark the discussion. And I also think that they are helping people understand that weight is not necessarily within our control. Our bodies have mechanisms that we can't control. And those are the mechanisms that these drugs are designed to work with.
Wow. Unfortunately, I'm out of time, Patty, but I think at the heart of what you're saying, what stood out to me is this is all about respect, and that's where the conversation has to start, with bedside manner and compassion. We now have a Bill of Rights. We'll see if it leads to some change and dropping the stigma. Patty Nece, thank you. Thank you for watching. Go to NewsNationNow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.